with spinal cord injuries. A lot of them are caused by trauma, some force being applied to the spinal cord, but they can also be caused by infections that occur around the spinal cord. One of the most common is something called epidural abscess. Abscess is simply a collection of infectious fluid that collects in the epidural space, which is the area around the spinal cord. That needs to be diagnosed and drained before it causes permanent harm. We've certainly had cases where patients had all the classic signs of epidural abscess. Somebody who's got the sudden onset of neck pain and they really didn't hurt their neck, and they also have combined with it signs of infection, like an elevated white count or other things, fever, that point toward infection. If you have infection and you have sudden onset of neck pain, and the person wasn't in some accident to explain the neck pain, then one of the things you have to think about is it possible they've got an infection around their cervical spine, which is the area of the spinal cord near the neck? You know, the classic test to find an epidural abscess is an MRI of the cervical spine. If the doctor orders just regular x-rays, you're not going to see an epidural abscess. You need to order the proper test and then drain the abscess before it does any harm. If it's happened to somebody and they call us, the chances are we've dealt with a similar case at some point in the past.